With our pledge of allegiance. Okay, good morning all. Appreciate you all being here today. Back in April of this year, Governor Braun signed a big property tax bill. And what it does is it gives relief to property taxes for individual homeowners and farms and businesses. So what that does is it impacts the county tremendously because that's where the revenue flows through. So what the state has said is we've given you this property tax bill to reduce that, but now the local governments, the county, then needs to look at other options to raise that money through local income taxes. So the council has been looking at all options. And so we're just in the gathering of the information phase to figure out what is going to need to happen, and when does that need to happen, and what's the best way to go about that. So if you were at our last council meeting, we did have a consultant here that presented a couple of different local income taxes that we could look at. An EMS tax, a public safety tax. We asked that he come to educate us on those different local income taxes and how they may impact, if we decided to do something, how does that impact our local residents here in their households? So again, we're in the information gathering stage. So one of the biggest things out of county budget, out of the actual general fund, is our EMS services, which we all need, right? Very vital to all of us. So we're wanting to kind of dig into that a little bit to get some information about current contract, maybe forecasting what it may look like in the next 3 years, because we have to have all this information to help us try to make the best decision possible. So we've asked Justin Harris, who is the CEO at DCH, who that's our contract with EMS, to come this morning and speak to us and give us a little information regarding that. Please, if you want to take the podium, we appreciate you coming in. We understand that you just are fairly new at this job, so we welcome you to give us any information you have.
90 days on the job.
There you
Right.
go.
Right. Well, good morning. My name is Justin Harris. I am the CEO at Davies Community Hospital, and just entering my 4th month. So really excited to be a part of our community, be a part of our hospital, our county, our city. I have started my healthcare career in rural healthcare, and that's because I have a lot of passion for delivering high quality care services in rural America. I've got a lot of family in rural America, and it's important. It's the heart of who we are as a country. So first and foremost, thank you. I appreciate the opportunity to present in front of you today. And being new to our city and our county, I'm honored to have the opportunity to present to our constituents and share about our hospital, where we're going, ensuring that high quality of care and standards are not just met but exceeded here at our community hospital. To foster growth of healthcare services, to bring new services, to bring new providers, so that you and your family members don't have to drive 30, 45 an hour to get basic healthcare services. Our hospital has a long-standing history here in Davies County, and while the healthcare landscape is changing and has changed considerably over the past 5 years, we want to continue to partner with our county, with our city, and our state to ensure that we have high-quality ambulance services here in Davies County. As we all are aware, the post-COVID environment has changed considerably for healthcare in hospitals, for rural RHCs, and no one could have predicted where reimbursements would go or not go, and where our costs would be skyrocketing across the industry. Reimbursements have remained stagnant, to say the least, and costs have skyrocketed. And so the cost and salary of wages of just our EMS department, just since we have started and initiated, has gone up over 25% just for salaries and wages. And still, we are lower than the regional and state averages across this industry. Our repairs and maintenance costs have gone up over 50% in trying to keep high quality care, ensuring that we have the right equipment to service our patients in our community. This is due to regulatory requirements. This is due to COGS, or cost of goods sold. And even more so, as we are in our community, we know that this is just the cost of doing business. And that business, the cost of business, is rising. Anyone that has a local business would know and understand that. At the same time, our team continues to work hard to capture every dollar that we can get and is owed to us from those insurance conglomerates. We know that they're not struggling, right? And so as denials and our deductions continue to increase, we are on the phone hours a day trying to ensure that they pay us for the money that we are owed. While I applaud the moves by the federal government to lower those costs through pass-throughs from the insurance companies to those that are providing the direct health care, we do have to work diligently with our local and state governments. And that means keeping health care local, right here in Daviess County. Just this morning, the Indiana Hospital Association had said it best. We know that Hoosiers count on their local hospitals to be there, always open, always ready, no matter the day or the hour. Access to care isn't just a talking point, but rather it's a promise that defines the work of healthcare and its mission. Every emergency visit, every surgery, every overnight stay reflects the commitment of our hospitals and caregivers to ensure patients can get the care when they need it the most. As we know, ER is not a choice most of the time. It is a need. It is an emergent need, and we have to be there for our community, both on the EMS services and our emergency department. From rural communities to our larger cities, Indiana's hospitals are working tirelessly to keep the doors open, as mentioned, to expand services and to innovate so that access is never a question for our constituents here in our county. As we continue to navigate those challenges and facing healthcare today, we have workforce shortages. Obviously, that's not just a hospital or a healthcare issue. That is nationwide in all industries that we are facing. Financial pressures, changing patient needs, and our focus does remain fast, ensuring that every Hoosier has access to high-quality healthcare right here in their city and in their own county that they live and work. Since enacting our DCH EMS department in 2019, we have served over 30,000 people and patients to ensure that they are getting that high-quality care that you deserve. By bringing them to DCH or transferring them to a higher level of care, we know that our constituents are being cared for by meeting, not just meeting, but exceeding those standards that are set for us by CMS, by Joint Commission, and other accrediting agencies. Of course, none of this would be possible without the support of you all, of our local and city and county commissioners, government, etc., and ensuring that we have that close partnership together to ensure that we have a hospital right here in Daviess County. In conclusion, I just want to come here today to not just share with you that costs have been rising over the past several years, but they will continue to rise. There is not an end in sight as of right now, until maybe the federal government helps and stabilizes the national economy and helps invest in jobs here in rural America, not just, again, in the urban areas, but focused, what Indiana is mostly made up of, is rural, hardworking Hoosiers. While we do depend on your support, CMS did announce earlier this year a 2.6 measly increase into the Medicare reimbursement for hospitals starting this fall, compared to those higher inflationary increases that we are seeing, and I'm sure you are too, across our county and city. Nonetheless, we will continue to provide high-quality care at DCH. We will continue to put our patients first. We will continue to bring more services. EMS is a needed service for our community. It needs to be high quality. It needs to meet, not just meet, but exceed these standards. And we do appreciate the county and the city's support. Thank you.
We appreciate the remarks. Anyone on the council have any questions they would like to ask?
Justin, is the biggest opportunity in the wages part of the EMS program?
Across the department?
Yes.
Yeah, wages are certainly yes, but I would say the reimbursement that you get from CMS, Medicare, Medicaid, even commercial is not even remotely close to what the cost of salaries, wages, the trucks, the equipment. The equipment supersedes that of most everything.
Okay.
Now, salary and wages is a lot of cost in most everything, right? It is the highest, but the reimbursement is really the issue, and that goes across the state of Indiana.
Well, how are we doing on staffing in the ambulance service?
It is difficult. Are we staffed to the standard that we need to be? We are. But it is difficult to find EMS, paramedics, to be in the trucks. It is. Because they are flocking to larger cities that have larger reimbursements, right, in urban areas, or larger subsidies from state and local city governments.
Go ahead.
Go ahead.
Without getting into the weeds, because I know we're not really talking about finances or something, just for me to understand, the reimbursement rates since COVID, what kind of percentages are we talking about over like the last 3 years? I mean, and maybe, it's too new to dive into that. I'm just curious.
Yeah, so I'll be very general.
Yeah, absolutely, absolutely.
Yeah,
That's all
so
I'm
very
asking.
general. In general, reimbursement rates in comparison to cost
Yes.
are roughly a fifth of that of the cost increase.
Gotcha, that's what I'm looking at. Thank
The
you.
increase in reimbursement to the increase of cost, right, year over year, is that.
Gotcha, thank you.
There is a shortage of EMS workers, is that correct? Or we are very competitive in our rural area between other counties, is that a correct statement too?
From an hourly rate perspective,
Yes.
I would say we are not competitive. We are at a rate that is average, right? Could we do better? Yes, I think that goes for the entire hospital. I've shared with our entire hospital and employees that over the next year we will be investing in, both operationally and financially, to bring more surgeons, more surgeries, more care, so that we can create the money, and then I'm just going to give it back to our people, right? Because they need to be raised rates, right? I'll go to nurses, right, for example, but we are a considerable less than our partners, right, both on the east and the west. And so it is hard to recruit nurses, it is hard to recruit paramedics, and they're going places that are not just $1 or 50 cents an hour, they're going $3, $4, $5 more an hour. And that's something that we can't compete here with at this time, which is the need for more partnership, it is the need for more services, et cetera. But yes, all I would say across the board, there's a need for healthcare workers, including physicians.
I don't know how familiar you are with the ambulance service itself, but it seems to me that one of the biggest opportunities is how overtime is calculated in that area. And I don't think it's just for us. I think it's for like the whole state of Indiana, maybe wider than that. But could you comment a little bit on that?
I don't know that I could comment on overtime specifically. I would tell you that is there opportunity for our EMS department? 100%. Right? I would say that for across our hospital though, whether it's in revenue cycle, whether it's in overtime and how we calculate it or we manage it, right, more so, there is quite a few opportunities within the EMS department. There is opportunities as with our local, we just made a management change, right, with Deaconess Health System. And while we retain 100% control of our hospital at all times, they also have a program that we can get involved with, that they partner with over 170 agencies across the state of Indiana to provide guidance and oversight and direction. And so we will be taking a part of that opportunity as well. But revenue cycle, there's opportunity there. To say that that will make us profitable or even break even is there's not a possibility for that. Across the state, across the nation, EMSs do not make money. It is a need for the community, and that's what the community deserves. And they should have that high quality care. And so that's why we do it. But at the same time, it's a business, right? We have to ensure that we don't, lose tons of money that limits the ability for us to do other services for our community.
I know you're new, but as of today, I mean, there's a lot of independent ambulance services not tied to a hospital. Are you comfortable moving forward that, hey, that this is where the ambulance service in Daviess County needs to be at the hospital, or do you see it maybe moving out to a private contractor?
I think the board had asked me this right before I arrived, as far as do you see that we need to get some other people to help us and we need to really outsource more? And I said, no. I said, give me 2 years, and I believe I can get our troops together. I can really develop a team, multiple teams, to gain on some of those opportunities that are out there, low-lying fruit, low-hanging fruit. And so at this time, I would say no. That is not something I think we need to run to. I would like the opportunity to partner locally with our city and county governments before we make a move to the outsource per se.
Okay.
And then I would be more than happy to come back in 15, 18, 24 months and say, hey, this is what we said we were going to do. Here's the results of those. And you can see it for yourself or not, right? That we want to be very transparent in how we do things, and there's no shame in sharing the success or not of that.
A lot of us are used to working 9 to 5 jobs. We go to work in the morning, go home in the evening, and we're done. Obviously, an ambulance service has got to be there 24/7. Could you explain what a typical shift looks like for one of your EMTs?
I couldn't.
Oh, okay.
To be honest with you, I don't know that specifically.
But obviously, you got people working
24/7.
24/7
Yep,
available
and there's
to
2
go out on
people
an
on
ambulance.
every truck at all times. Yes.
Okay.
Yes. Sorry.
That's okay. No,
Yeah.
didn't mean one trying to
Yeah,
catch you
yeah,
there or anything. I just
yeah.
wondered, 'cause
No,
a lot of
it's-
people, when we talk about overtime and stuff, a lot of people aren't used to working that kind of a shift where they got to be available to work, at any hour of the day or night, weekday, weekend, whatever.
Yeah, in general terms, right, shifts can be anywhere from 8 hours to 12 hours. And so whether if they're 12 hours, 3 12s in a week, maybe they're 10s and they work 4 10s, and that's kind of how it's split up. I am not specific to know about our EMS department and what their shifts are. But yes, it is always staffed 24/7, 2 people on a truck. Yes.
On that note, I've been contacted a couple times, and actually just recently, but also in the last few months, I've been contacted too about concerns about coverage and the lack, or I should say the lack of coverage. And that primarily focuses around transfers that we're sending our ambulances out for a lot of transfers, thus not providing the coverage that citizens within Daviess County truly need. You may have shifts full, but if we've got transfers going to wherever, Evansville, Terre Haute, whatever, then we've got holes, and then when it's time, we have to pull an ambulance from the other end of the county, depending on where you're at, to actually cover true needs within the county. And so obviously that gets back to staffing, having not only enough staff, but also enough ambulances. Have you discussed or been involved with some of the
So that is not just
regarding
a
transfers?
So that's not just a here concern, I would say. That is everywhere. The ability to transfer patients that are non-emergent, right, and trying to get them to the local hospital, the other hospital, right, for higher level of care. Again, not emergent care, or transferring to a nursing home, or somewhere like that. That is a problem in rural America because there are no taxi or transfer services. Most mid-sized towns, including like Evansville, have partnered with city companies, private companies to provide those services, so that then it frees up their EMS services for actual emergent pickups, transfers, etc. We don't have that here. A lot of rural places don't, but it is certainly an issue across the nation.
That could be an opportunity for someone to come in to
Agreed.
to primarily just be a transfer.
I agree. I agree. We would love to have that conversation with anyone that would want to partner with us on that. As a hospital, that's not something, sometimes our police force gets involved and does help do that transfer. We do have a car for that, but it is not for that use, right? It's really in an emergent need.
So on that note then, with regards to that, does it require a fully capable band as well as ambulance that has all the full equipment? If we're just doing transfers of,
Yeah, I don't know.
non-emergent
I don't know.
situations,
It's governed by the law, CMS, IDOH. We'd have to get into those regulations to ensure that we're meeting those, they're meeting those, whoever we would partner with. I can tell you the reimbursement is considerably low, like very low on those. You can bill and collect for some of those services. So that's why it's a partnership with the hospital, with the county, right, to be able to make that at least somewhat beneficial for everyone involved.
Justin, you mentioned, our local situation, the rural hospitals and ambulance services struggling. The bigger hospitals, the bigger cities, are they struggling as much as the rural, or the same? Are they having more struggles? What's your feel for that?
Volume is key, right? So in bigger cities, you have a lot more volume going on. And so the more volume, the more you can bill and collect, the more you can get reimbursed, and thus you can get better trucks, and you can invest in your team and higher rates, et cetera. So I would say, as a general statement, they're probably doing better, right? Just because the volume is there. Our volume is roughly 4,500 runs a year. And that's been pretty consistent over the past 4 or 5 years. We meet the standards of time and emergent response times per the NFPA, and we do considerably better on that actually in our primary service area because our team does so well. But the model so from a Deaconess Health System perspective, the model is to partner with city and local governments. They do not fund it 100%, but it is a break-even model. No one is trying to make any money off this service because we know this is a right. We want our people to ensure that they have this, right? And it's high quality. And the drugs are up to date, right? And the equipment is up to date, and the care is number one. So, from a Deaconess Health System perspective, it is just a break-even model. Partner with us, we're going to provide high quality, right? Just help us break even in that type of model. Sometimes in larger cities, and I don't know the specifics of any other counties, but they may not have to pay anything if they're break even, right? So, but I would assume in larger cities, the volume obviously, makes it more worthwhile.
More attainable.
Yes. And it's just, the county, our county and how many people we have and how we serve. And obviously, while our average run time is, less than 9 minutes, right, to pick someone up in our primary service area, that's pretty good. Mm-hmm. I would also say going down towards the river is going to take you a lot longer. Right? I mean, so the average, right, is maybe higher, but in rural America, you have to understand going, over to Kendallsburg, right? We have a truck and a station there, but going towards that area, going down the river, right? Towards the river, it just takes longer. We don't, mm-hmm. That's what rural America is about. That's okay. We're going to provide it, and we're going to still be there for them.
So the 4,500 runs per year, does that include transfers?
To my understanding, it does. There's no separate number.
So have you considered, is there any benefit to trying to partner with maybe other adjacent local counties? Sometimes there's an economy of scale there that if you can partner, has that been on anybody's table?
So recently, actually, there was an RFP, a request for proposal, from Martin County, and they were interested to see if who was interested, right, in taking over their service. While we have a lot of opportunities here in Davies County and needs quite a bit of attention, right, to ensure operations and financials are in line, we felt there was an opportunity, as you just mentioned, economies of scale, right? And so we did submit a proposal for that. We submitted a number that was higher than ours, knowing what it takes to run a service in Martin County and the landscape, right, of Martin County. Honestly, knew they probably wouldn't accept it, but what I did offer was, that's okay. I'll be happy to help you from a consulting. Maybe we get together and we say, all right, let's partner on this and we'll cover this area. You know, like how do we work together? Maybe we share staff, right? There is a lot of opportunities there. Ultimately, they did not respond, nor did the other participant in the RFP at all. Because of what they required out of their RFP. They had very high standards as far as how many trucks, where they could be, how many people were on it, like over and above the NFPA standards. That's their call, and that's what they want, and that's okay. But they I guess, partnered with a private company. So yes, trying to. I would 100% agree with you. Yeah.
And I guess the question for me then, I mean, it's obviously they're in a unique situation where they were looking for assistance. And in another case, maybe would be partnering with a Knox County or partnering with another county that's got an existing infrastructure and workforce there. There's a way that we could collaboratively work together. I don't know.
I would agree with you.
Looking
I would
at,
agree.
you know, at this stage of the game, I mean, when you look at the numbers, to me, anything's on the table.
I would agree.
To,
I would agree. The door is not shut from our standpoint. I think we'll see, our people should see a change in how we work together across our counties, between Good Sam, Deaconess Memorial, us, Perry County, Gibson, right? All these hospitals that are here in southern Indiana, southwest Indiana. And while it seems, my perception in my first 90 days is that we're always competitors and we're gonna do everything and we're gonna beat you, and you know, like rural hospitals closed because of that. I mean, I have been in a lot of states and a lot of rural places, and when you think that you can do everything by yourself without partnering, right, you're probably going to fail, right? And I don't want that for our hospital, and so that's why, you know, at Good Sam, I've met with them multiple times. I've got a couple affiliation agreements that like, hey, why don't we partner on this service line? Why don't we think about doing this together? Why don't we share a doctor, right? Those types of things. They are more than happy to be opening that door to us, because I'm not trying to like beat them to the ground, right? Let's do what we do very well at high quality, and then where we maybe can't or don't have the funds or whatever it may be, let's partner, right? So that we can continue to provide that care here in Davies County.
like I could see some benefits from probably more so from labor force standpoint, because I know that a lot of, I know some ambulance and EMS folks that work outside of, live in Davis County, but work in other counties. And so in terms of driving that, it gives you a larger pool from a resource standpoint. When resources, as you mentioned in the very beginning, resources are hard to come by.
I agree.
But so if you've got a larger pool to pull from, you can accommodate situations when you've got to maybe pull somebody over, and anyway.
I agree with you.
Just,
I agree. We've got to be able to work together throughout our counties here in Southwest Indiana, and I think we will. And part of it is also, I would say, is Deaconess Health System, right? All of us are kind of connected to them. While we, again, retain 100% control of our hospital and what we do, capital, operationally, et cetera, Deaconess Memorial was acquired, right? And Good Sam is fully independent, but they are affiliation and partnering on like EMR, right? Their Epic platform, right? And that's what, we look to do that too, right? So that when you go to Good Sam, you go to Jasper, you go to us, it's all in the same system. Doc can see everything you're doing, right? And that is truly what was one of the goals of Obamacare, right? Is to try to get that cross collaboration of care. And we don't want the government to tell us what we have to do, right? So we're now doing it on our own through these platforms. But again, trying to partner together with the help of Deaconess Health System is a huge positive for Southwest Indiana, because they truly do not want any more patients in Evansville. There is no more room, literally. So they only want to service the highest of acuity, or the most sick patients, right? And everything else, they really want to keep local. And you look at their hospitals that they've partnered with: Henderson, Kentucky, Marion, Illinois, and they'll do it in Jasper, Indiana, and they're going to do it, or they're going to help me do it here. Is that we're going to keep care local. You don't need to drive to Evansville or Indianapolis or Bloomington for basic health care. It'll take us a couple years to get there. I need some patience and I need some buy-in, but at the same time, we will do it. There's no doubt. But that goes with relationships.
No, Justin, I appreciate what you said about partnerships, because that's so important to our community. I've been very encouraged just in the brief time that you've been on board, talking to some people in the administration about how people are really looking at operations. They're kind of fine tuning and looking at that, which is encouraging, because we're talking about the business side a lot in this conversation. But what we're talking about on the county side is how do we continue to fund that so that our constituents have that service and have that quality service that you're talking about. So I appreciate everything that you said about those partnerships, because we're going to need those. And it's not us against them anymore. It's like, how do we help each other get there? And I think that's important from, just the people need to know that we're a part of that, and that you guys are wanting that as well. I think that's it's going to be a positive outcome. So appreciate you.
Ultimately, we need everyone's support, right? And so, everyone, the support of having everyone of our hospital and just giving us a fresh start is what I would ask. That's all I ask, right? Everyone's had a bad experience everywhere. Everyone's had a good experience too. I ask that you give us a fresh start. And ultimately, we will build this hospital back to great times, right? We will bring more services. And ultimately, keeping healthcare local is the most important thing. We will never sacrifice a dollar for the patient. Never. The patient will always be number one, and we will strive to provide high-quality healthcare.
Are there any other questions from council this morning?
Jerry.
I was going to ask if there's anyone from the audience who wants to speak. You're welcome to do that. Justin, do you just want to have a seat? Because we need them. Okay, but we need you to come to the mic, if you will, so everyone can hear.
Well, I think there may be in the community a void.
We have a mic or something.
Do we have a mic? Don't have one.
Yeah, we need Do we have a microphone? I think he's got it. I think we're
I
good.
think we're okay
Yeah.
now.
Thank you.
What I was wanting to say was, I think there's a big void being missed, because, sometimes not all ambulance stations, I don't mean this to be confrontation, are filled. So the fire departments have to sometimes work for 35 minutes. It's been documented. And we don't know where the ambulances are coming from a big part of the time when we're being dispatched. And I hear a lot of the younger firemen say that it would help them if we could get some training. And training is expensive. Little fire departments like Plainville, Eleanor, Alfordsville, the ones that's down by the river, if we could get some training to where we'd feel a little bit safer to help with these patients until the ambulance gets there. First Responders is a very good program. I did work heavily on it several years back to get it going, and some others. Dwayne Murphy was in there. And I just feel like, I know you guys, I don't know if you was aware of this situation, but 35 minutes with not very much training is kind of nerve-wracking. And you want to do what's best for, I mean, that's what a fire department does, is do what's best for their community. And I was wondering if there was some way that I mean, I know it's a big tackle, some way that maybe the hospital and the county could maybe help us get this training to where we would feel more comfortable until the ambulance got there. I mean, we know that there's stuff you can't always predict. Maybe a wreck down by the county line on 50, but yet we got a problem up north. And we've only got really 4 manned ambulances. And you know, I'm not saying that anybody's responsible for it, but people do have to be transferred to Indianapolis, and that leaves 3. Well, then if you have a wreck and you have a couple ambulances there, you got 1. And in closing, I know that like if Odin is not got a coverage up there, and I'm not trying to go back and say, look at the past, but we used to have to go up and set at Plainville or Graber Post to kind of center ourselves for the next emergency. And I feel that needs to be addressed too, you know, because that way it puts them, and there's always going to be a time it can't happen. I'm very aware of that. But I mean, I see it, and it's my neighbors and my family and the community, friends. I mean, my age group's getting up there too, you know. But I think that them things that could and should be delivered, and it could help out with you guys when we do have a 35-minute delay. And you know, if we had the training, a bunch of the younger ones that's coming in, if they had the training, they'd feel much more comfortable and at ease of handling certain situations until the ambulance got there. And I don't mean this to be a slam, not at all. Because I mean, if anybody knows me, I've done this for a few days anyway. And I just want what's best for the county. I know we're in times that are testing to everybody. And I was wanting to see if there was anything that could be done about that.
How many years were you an EMT, Jerry?
I started in 1980.
1980.
And then been on the fire department in 1980. In fact, both came about the same time. And I've enjoyed doing it. I enjoy this county. I wanted to stay in here in this county, and I believe in it. So I thank you for the few minutes here, and I hope that we can keep shining up. But it is a rough thing with the ambulances now. I mean, all them years, it was hard to get help. Thank you very much.
Thank you for your comments, and I am not familiar with that first responder program, but we will definitely check on that to see if that's.
Murphy and another one that I can't remember. We started it on the west end.
Okay.
We started classes. Odell, Laura, some of you may know some of the paramedics. Martin, several others. All of them started.
Well, that was a great comment, and that reiterates the partnerships that we talked
Right.
about a little bit earlier. And as we're looking at what we want to do financially here, I think it's very important to keep that in mind, that we want to create those partnerships so we can acclimate the whole community.
Yeah.
Everybody needs that training. We need to have the ambulance service quality. So, no, definitely, I know this body is taking a lot of notes to make sure that we're doing the best for the community. And that's one program that we need to be a part of as well. So.
Did you have comment?
Yeah, I got a couple questions.
Sure.
My name's Paul Traylor. I've lived in this Davis County most of my life, except for when I had a farm out in Princeton. And What I want to know is, are we going to be taxed twice on this? Because every time the ambulance goes out, the fire department goes out with it. We're paying that tax. Most of your firemen are first responders. And I know for a fact that this class can't be that expensive, because I worked for Peabody for 34 years, and we sent people to it all the time. And we had our own first responders at the mine, even had our own ambulances. And you was talking about the tax breaks earlier. That's just for 65 people, 65 and older. And
It won't be, it's gonna be for everyone.
It's everyone.
so there'll be no property tax altogether.
No, there will be a property tax, but you should see a reduction in your property tax. And I can't say exactly how much, because it's different depending on the value of your home. So there's a calculation that the state will do. But you will see a reduction in your property tax.
Yeah, but then wasn't they saying, I mean, I could be wrong in what I've been hearing on it, no property taxes on people 65 and older?
That's not a correct statement either. There's
You get a
another.
deduction.
A
You get a
deduction
deduction,
for someone 65 or older.
So
that-
the raise in assessments and stuff is gonna take care of the deduction that we're gonna get then?
Actually, no, you should see a reduction in your
Okay.
property taxes.
Well, that, and I don't know, and back to what I was talking about to him, I don't know about as far as the volunteer fire departments, but I know here in town, every time the ambulance goes out, the fire department goes with them. Is that not correct?
I don't know.
Yeah.
Couldn't tell you.
Okay, well, I just wanted to see if we was gonna be getting taxed twice on
It's
this.
a good question. That's what we're looking at too, because we have some different options that we have. So, there's an emergency management tax, and then there's public safety tax, which includes those fire departments. And we're looking at all those different things because it's all important, right? We want to make sure.
Well, they used to say every time the fire department went out with them on a run,
Yeah.
that they turned that in and they got so much money for doing that each time they went on a run.
Yeah, I'm not sure. They get
And then
reimbursed.
that money comes out of our taxes too.
Volunteers don't.
Yeah. I think volunteers, there's no reimbursement for that.
But
Well, the township pick up some of the.
Right.
Yeah.
Yeah. But no, definitely, it's important. And we're looking at that, so.
well, that's all I got, and thank you for your
But
time.
one thing too, at our presentation last month from our
Consult.
consultant firm that helps us out, with the Senate Bill 1 and going down the road, they're gonna put more responsibility on local county governments and less on the state government. So we've got to get our ducks in a row. How are we going to be able to fund everything in the county that needs to be funded so we can have an ambulance if you have an accident? We have to try to figure these things out at the local level now, because we're going to get more responsibility.
Yeah, well, I mean, just like your average person in the county, they're having to cut back, and cut back. Maybe the county should cut back.
That's a good point.
That's right. That's right.
You're exactly right.
Thank you.
No, thank you for your
You have
comments.
another comment?
No, it's not comments. And I understood that when the federal government stopped reimbursing for something, it would be dropped down to the responsibility. I mean, that's kind of the way that they're leading you to think.
Well, definitely
TV's not always right.
the state is definitely moving that way.
Yeah.
They're gonna put less pressure on the property taxes, more on local income tax, which we will have responsibility
Yeah.
for that. And it's a phase-in thing over the next 5 years, and in 28, I think it hits pretty big. Right now,
Yeah.
we're projected to lose over $1 million in property tax revenue for next year.
But will that, by you trying to cover it, they also want you to.
I don't know that it's cheaper. They just want to put more responsibility and pressure on every county and less on the state, is the way I look at it.
That's true.
Yeah, I haven't seen it become cheaper.
Well, I was just wondering if the gap bring it down would be.
Well, and it kind of depends, because homeowners will see their property taxes go down. And when we talk about these local income taxes, that's based on your income, right? That's how that tax is assessed. So if I'm a high income earner and now I have this local income tax, I may pay this much and my property taxes just went down this much, right? So maybe then I am paying more. But for people retired, lower income, median income, it should be an overall savings, but we can't say that for sure because we don't know what everybody's income is, right? So that local income tax is based on income. So if a business owner has a really good year, they're gonna pay more.
Maybe not unmodified. They're not gonna worry about it,
Right.
but on a regular day.
So the presentation we got last month from Jason Simler, our consultant, said that if we would adopt a 0.09% income tax for the EMS, someone making $68,000 a year would be charged $58 more income tax. And a public safety tax on his projections at 0.13%, that same $68,000 wage earner would pay $83.78 more in tax to provide these services per year. It's pretty minute if you're laying in a ditch upside down in a car and you're waiting on that ambulance to get there. $68 or $58.
No one wants taxes to go up.
Nobody.
None of us up here want to do that.
Yeah.
We all pay them.
Yeah.
What we want to do is to be able to maintain a high level of care for everyone, whether it's fire departments, whether it's EMS, whatever it is. We want to take care of the people in our county. So we're trying to figure out how best can we accomplish that. And to be financially responsible, to do the best thing that we can do.
I think that's the key that Marilyn said. Right now, we're subsidizing the ambulance service at $800,000 a year to go into the hospital. And that's just went up $200,000. And they're not making money. They're not going to make money on the ambulance service. I don't think it's going to happen. But hopefully we can move that way. Right now, we're paying for that out of the general fund. So your property taxes right now are paying for that. What we're looking at is, we're going to be having $1 million shortfall in our property tax revenue next year. Where is that money going to come from? I can tell you one thing for sure. We are in good shape as we sit here today. We're in a lot better shape than the majority of the counties in Indiana. I can share that with you. But our reserves are only going to last so long when you're continuing to lose $1 million. And it's projected to go up each year after that until 31. So we have to be prepared. And there's going to be a lot of changes locally, definitely with the income tax. Over the next 2 or 3 years, things are going to change there.
And what we don't want to do is have to react when all these changes are forced upon us. We want to be proactive, try to think out of the box and figure out some things that we can do to help this situation as these shortfalls are going to come. I don't think anybody wants to have their property taxes go up anymore, but yet again, we have to provide services, so we have to figure out a way to get the money in here to provide those services. So this is just kind of the informational part that we're trying to work through right now as to how we go about it and when do we go about it.
And the financial consultant they're talking about is Jason Simler from Baker Tilly. We've used him the whole time I've been on here. They're financial experts. They're very good with what they do. They tell us what we need to hear, not what they think we want to hear. And so when they lay things out for us, they'll paint the picture the way it is. And he's shown us that these effects on these property tax deductions cuts are going to hurt us more down the road than maybe they are now. They're hitting home more now for your cities and your townships, your smaller towns and so forth. It'll catch up to the county in time. And like I say, I've dealt with him the entire time I've been on here. He's very good. And he knows our county finances very well.
You talk medical, you talk fire, you talk police, you're talking
I don't think
I don't
he
think he
would
did,
know as
no.
far as equipment wise or any of that. But they probably work in the majority of the counties in Indiana and have a good feel for what Senate Bill 1 that was passed this year is going to start affecting all of us at the local levels. Yeah. Yeah, I don't doubt it.
Are there any other comments from the audience?
I just got one other question. What's the average cost of an
Depends on whether you want to fully stock or whether you want to. I'd say in today's world.
Well, you got to talk about whether you're going to keep the bed, the chassis, the what's on it. I mean,
The cost of an ambulance is, you know, at a very basic level ambulance, right, is no less than for a whole ambulance.
No, I was talking about the cost of a run, what they
Oh,
do.
oh,
Well, and that's going to vary by what insurance you have, right? The reimbursement, because they may bill a certain amount, but Medicare only pays so much, Anthem only pays so much. Each insurance company has their own negotiated amount that they will give as a reimbursement. So no matter what they bill, they only get so much in a reimbursement. And those numbers have decreased considerably over the last 5 years, 6 years.
Well, I don't know, it seemed to me like 10 years, 15 years ago, maybe the average ambulance run $5,000.
And I think it depends on how many miles they're going as well. You know, all of that plays into that calculation. So
services provided, medications.
yeah,
on-
yeah.
that would-
If you have those specific questions, I'm sure Justin would be happy to schedule an appointment maybe with you to discuss some of that.
Yeah.
Because he may not have that information here today, so.
Justin, who is the director of our ambulance service? Do we currently have a director? Or?
So the director has been our ER director, and have a manager, and we've got a couple other supervisors within that. Actually, our ER director left the organization, so we've now replaced that. But it's the ER that supervises. You have to have a supervising hospital for an EMS service. Currently, it is.
Okay.
All falls under, of course, our chief nursing officer as well. And
Any other questions from the audience?
I appreciate the discussion and
Yes.
everybody that was here, so
Yes.
thank you very much.
Yeah,
That's
we
going to help us
appreciate
out.
it. Yeah. Thank you, Justin, for sharing. To look for a motion to adjourn.
So moved.
I
Second.
made the motion, Matt made the second. All in favor?
Aye.
Adjourned. Thank you all.